The bureaucracy surrounding supplementary prescribing rights is a barrier to people prescribing. So what independent prescribing would mean is removing those barriers so that dietitians could prescribe for patients. They would get faster access to medicine from the experts in nutrition and diet.
Supplementary prescribing has got certain boundaries to it, I guess, and that can make it really difficult to be able to work in a really cohesive way with patients.
I think one of the big things from an independent prescribing point of view for us is time saving. In the setting I work in, it's a bit of a one-stop shop, so hopefully it will enable me to see more patients and provide the most effective, safe care I can.
More dietitians would be prescribing, and dietitians that have qualified as prescribers would be prescribing for more patients.
It would mean that we wouldn't miss any opportunity. Sometimes you're required to see a patient quite urgently. You don't have the time to put that into place. So it would really slick the process and mean that we could prescribe more often and without any hurdles.
That would mean a lot less red tape and paperwork, and therefore more time to spend with our patients to give actual care, and less wasted time with GPs chasing medications.
Our patients would get access to medications a lot quicker and faster. We would also be able to empower them to manage their conditions themselves, because we would help them to understand how to match their medications with the kinds of foods, because people have different foods, different days, and so they'll be able to match those things, two things together to improve their symptoms and feel much better.
It would save time, it would be more efficient, it would be cost effective.
I think it would save the NHS a lot of time and a lot of money. Everyone would benefit from that, the taxpayer, patients, doctors. It would make everybody's job easier.
I think we will save the healthcare system and the NHS so much money and free up that GP and consultant time and get these drugs prescribed out of hospital care.
It would make our work a lot more efficient in practice, and it would make the roles even more autonomous.